this video, we'll be discussing the differences between pertaining to and condition suffixes. They are often used in medical terminology. So what's this video about? Medical terms are often made up of word parts, for instance, prefixes, roots, suffixes, with each word part having a specific English meaning. A suffix is the last part of a medical term. This video includes a short lecture helping students differentiate between suffixes that mean pertaining to and those that mean condition or condition of. So who cares? Why should you know this? Well, by learning this skill, students will understand contextual cues while reading medical information such as textbooks, orally communicating with colleagues and professors, and putting terms in correct context when writing. The use of these two types of suffixes are very common in medical terminology. Unfortunately, many students struggle with these concepts by misidentifying their meanings, which can affect the context of a term. So remember those nouns and adjectives you learned about way back in grade school? Well, a noun is a person, place, thing, or idea. Examples are girl, person, school, place, chair, thing, knowledge, idea. Medical terms ending with suffixes that mean condition are nouns. Often in medical terminology, they indicate an illness, a medical condition, or a procedure, since those are things or ideas. An adjective is a word that describes a noun. Medical terms ending in suffixes that mean pertaining to are adjectives, and we'll give some examples later. So how do condition and condition of suffixes work? Well, let's take a look at some sentences. Scoliosis is a curving of the spine. Stitches will be used to enclose the incision. She suffers from hyperthyroidism, and I have a phobia relating to spiders. In all the above sentences, the underlying term is a noun. So how do condition of suffixes work? Well, let's take another look. Let's pay special attention to the suffixes. Scoliosis is a curving of the spine. Stitches will be used to close the incision. She suffers from hyperthyroidism, and I have a phobia relating to spiders. In the above terms, the suffixes all mean condition or condition of. Osis, ion is shun, ism, and ia. So what are some of the other commonly used suffixes that mean condition? Starting from the top and going clockwise, osis and cis, ism, Asian and shun, ia, isis, y, which is pronounced e, and iasis. These all give medical terms noun endings. Emia is another special case. Emia means blood condition. It's a specific type of condition. So about pertaining to suffixes. Let's take a look at these sentences. The nurse used a hypodermic needle to draw blood. Brushing my teeth improves my oral health. My sister is studying nuclear medicine. And Tom is hilarious. In all the above sentences, the underlying term either describes the next word, which are nouns, or a noun somewhere in the sentence. A word that describes a noun is called an adjective. Without the following noun, or without a noun, the suffixes do not make sense, such as, my sister's studying nuclear. It leaves you asking, nuclear what? Fusion? Bombs? Medicine? What? Nuclear what? Let's take another look at these sentences. Again, paying special attention to the suffixes. The nurse used a hypodermic needle to draw blood. Brushing my teeth improves my oral health. My sister is studying nuclear medicine. Tom is hilarious. In the above sentences, the suffixes all mean pertaining to or relating to. Ik, us, al, and our. When seeing these endings, typically a noun will follow. So what are some other common suffixes that mean pertaining to? Again, starting at the top and going clockwise. Al, ak, and eak. Us, eel, ar, and ari. Tik, ik, and ickle. So what do we really need to know? First, suffixes that mean condition are nouns. Medical terms often have a suffix mean condition, and they indicate an illness, a state of being, or a procedure. Suffixes that mean pertain to are adjectives. You can tell by the noun coming after it. For example, hypodermic needle. What type of needle? A hypodermic one. Unfortunately, you're going to have to memorize which suffixes mean condition and which suffixes mean pertaining to. So, let's take a quick quiz to see our understanding. Are the underlined terms nouns or adjectives in the following article title? Hint, the suffix is al. Recent advances in gel technologies for topical and transdermal drug delivery from the medical journal Drug Development in Industrial Pharmacy. Are these adjectives or nouns? The suffix al means pertaining to, which indicates an adjective. Both topical and transdermal describe the type of delivery. For the following title, is the underlined term an adjective or noun? Hint, the suffix is ion. Clinical score to predict the risk of bile leakage after liver resection. From the medical journal BMC Surgery. Is this an adjective or a noun? The term is a noun. Here, resection indicates a type of surgery, an idea or thing. Third question. For the following title, does the underlined term have a suffix meaning pertaining to or condition? Hint, the term ends with ick. Father's occupational exposure to carcinogenic agents in childhood acute leukemia. From the medical journal BMC Cancer. Does this mean pertaining to or condition? The term ends with ick, which means pertaining to. This indicates an adjective. Carcinogenic describes what kind of agents. And the last question. For the following title, does the other underlying term have a suffix meaning pertaining to or condition? The suffix is emia. Father's occupational exposure to carcinogenic agents in childhood acute leukemia. From the medical journal BMC Cancer. Does this term have a suffix meaning pertaining to or condition? The suffix emia means blood condition, a specific type of condition, which is a noun. Well, there you have it, the differences between pertaining to and condition. However, unfortunately, the best way to know this is to start hitting the books, making note cards, and memorizing. Good luck.